Good afternoon and welcome to Building Identity Governance into Your Post-COVID Security Strategy, a health system CIO Media Inc. production sponsored by Imprivata. Just a little housekeeping before we get started. My name's Anthony Guerra. I'm the editor-in-chief of Health Systems CIO, and I'll be your moderator today. We're looking forward to your participation. You can send in your questions or comments at any time in the Q&A box. We'll take those later in the program, and we'll have a one-question poll we do later if we have time to get some of your input. Just so you see how we're going to spend our time today, first we're going to go about 35 minutes or so with our panel featuring Slayton, Austria, CTO at UW Medicine, Ben Smith, VP and CISO with Nuvance Health, and Wes Wright, CTO with Imprivata, and then we will have our Q&A. So let's, nice way to view the screen today. You can click on the top center, get it in side-by-side mode. You can adjust the divider to get the slides and the video boxes the size you want. And it should say speaker view in the top right-hand corner. So let's jump right in. We have an interesting topic to discuss. So let's get going. Slayton, let's start with you. Can you give us an overview of your organization and your role?
Absolutely, and good morning to those of you, although it may not be morning to everybody. My name is Slayton, Austria. I'm the CTO at UW Medicine out here in Seattle, Washington. I've now been here almost 2.5 years, which is kind of a weird feeling to say that as well. But yeah, UW Medicine is academic university health system, trauma tertiary level 1 health system here in the Pacific Northwest. We have 3 primary hospitals that are operate under UW Medicine. We have an affiliate hospital as well, so 4 hospitals total with a significant number of clinics that coincide with the service into those hospitals. All in about 26,000 staff throughout the health system. Our IT operations, we have just under 600 ITS folks supporting all of UW Medicine Health System. We are a brand new into the Epic inpatient side, so we literally just went live March 26th on the inpatient side, but we've been an Epic customer for quite a long time. We actually went live with the ambulatory side all the way back in 1998, and so I've been a customer. But transitioned from Cerner to Epic, and we are now all in with just about all the Epic modules throughout the organization. We did a big bang cut over to 3 hospitals in one night to go live within Epic. In the midst of, and I'm sure we'll have some conversation about, is we did all of this pretty much remotely. One of the first organizations that really kind of didn't kick the can down the road. We had to go and get this done, and so we literally went live in the midst of everything COVID. So we had to really rethink our strategy and our implementation, all the remote folks coming in. So we talked about from a security perspective and what we were trying to manage through. You know, you think through the traditional onslaught of Epic consultants and everything else that would be on site doing at the elbow, to what we ended up having to do remotely with all of the service lines to help us get through some of that as well. So like I said, UW Medicine as a whole, very large health system, large operations, and one of the premier health systems here in the Pacific Northwest. So.
Very good. Thank you. Ben?
Hi, folks. I serve as the Chief Information Security Officer, as well as the Vice President of, what is it today? Innovation, Digital, and Development delivery for the health system. The Nuvance is a 7-hospital, roughly 250 clinic health system that's spread across the New York and Connecticut regions, kind of serving the northern New York City suburbs. We're actually a relatively young organization. We were formed out of a merger in early 2019, and I actually joined about 3 months post-merger, just in time for COVID. So got to move across country. Actually got to meet both Slayton and Wes while I was out in the Pacific Northwest, serving as the CISO for multi-care health system. My role here at the organization, the VP title kind of is self-explanatory. On the CISO side, I own all parts of information security, from governance to security ops, SOC, that sort of thing, as well as identity and access management. And since joining the organization, we've gone live with an IDG solution, and we've hit all the pitfalls, we've hit all the successes, and actually went hard live in early May. We can have a long conversation about order of operations when it comes to delivering a solution like that, along with a whole bunch of other integration work that's going on due to a merger. So thanks for having me. Looking forward to the conversation.
All right, very good. Wes?
Echo Slayton's good morning and good afternoon to everybody else. Thanks for having us again, Anthony. My name's Wes Wright. I am the Chief Technology Officer out at Imprivata. It's been a quick 3 years that I've been at Imprivata. Prior to that, though, I had about 25 years of various CIO, CTO, and when I couldn't avoid it, CISO roles. And on the health delivery side of the organization, this is my first venture onto the vendor side, and I tell you, I couldn't have done it with a better company than Imprivata. I just love the way they take workflow first and then put the technology in place. So really looking forward to today's discussion, Anthony, around identity governance. And Ben, yeah, please share some of the successes and the pitfalls, and watch out for this kind of stuff that you've encountered when you stood up whatever system you're using out there.
All right, very good. Let's jump into our first question. Ben, we're going to start with you. Let's set the stage for our discussion. What are the challenges around managing identity governance with a manual or homegrown solution? What are the security vulnerabilities? And how did COVID exacerbate these challenges?
Thank you for starting with a three-part question, because
Anytime.
why would we start with an easy
Right,
question?
right.
No T-balls here. Identity governance at an organization the size of Nuvance, and even organizations significantly smaller than Nuvance, is a mess at best, especially when you're trying to manage it. Using your native Microsoft tool sets, or God forbid, spreadsheets. I think in general, the security vulnerabilities come from the things that you miss, the things you can't keep track of. The bifurcation of access deployment and delivery to users across your entity. Users being able to create their own access permissions and setting things up to quote unquote make the business run easier. All of these things come together to, really open up the door to what is quite honestly the biggest vulnerability your organization has, which is your people. You accidentally end up with, a general user that has admin rights, that doesn't have two-factor authentication and is running around, or heck, even does have two-factor authentication these days, and is running around reusing their password all over the place. All of a sudden you end up with an attack that is significantly easier to execute against your organization. COVID in of itself, I don't necessarily think exacerbated the issues. I think the idea of working from home and working remotely, or quote unquote working from anywhere, is probably the better way of looking at it. I guess, yes, COVID is probably the underlying cause for some of that, but that whole situation, just the move to remote work, as well as quite honestly the acceleration of adoption of new technology, has created multiple other vectors, or at least that acceleration has created another problem for the organization. And that, without some automation, without some tools to support your IAM team, it's really easy to get behind and not be able to properly service your organization. We certainly saw that here at Nuvance, as we rolled through COVID adoption, or COVID, and that remote work and new technology adoption.
Very good. Slayton?
Yeah, I was going to say, when we drill down into the homegrown, us being an academic university medical center, we love to turn around and build our own things. And so it really did, as we looked through what we were doing, we were right in the midst of implementing a brand new IAM solution on top of an external federation piece as well, in the midst of preparing for going live with the Epic on the inpatient side. So, and then when COVID hit, I would actually say, COVID was the underlying piece, but as Ben talked about, working remotely, drove it. We did not have a major work from home force, so the university medical side did not have a large work from home, and March 17th of 2020, everybody just was told not to come back. I think where COVID might have caused some of the issues is all of a sudden folks were having to try to reset their passwords in an old type of system, going back through and managing that remotely, and if they weren't connected directly. And so when we talk about the vulnerabilities, there may have been times when you were trying to do the validation through, call to the help desk or wherever. It was trying to really figure out in a on-the-fly type scenario, thousands of users all of a sudden, they went home and their passwords started expiring. How do we manage those? New users coming on board, how do we onboard folks appropriately as well? So it's been a huge challenge for us, looking at where the vulnerabilities were. We're just really going through that risk avoidance piece and figuring this piece out, because I think everybody made some significant exceptions when COVID hit, period. You can't just sit there and say everybody was perfect and ready to go. We all made exceptions based on those risk exceptions, or risk potentials. So in regards to the challenges around managing that identity governance, really for us was taking what we had built out in a homegrown system and trying to transition that into a third-party vendor provided solution. We've got a lot of things that we built out custom that you're never going to find the perfect fit. And so when you make this major customized product out here and you can try to manage through getting this turned on and saying, it may not do this, but it'll do 80% or X of this. So managing through that change management of people and the change management of the technology side, I think was one of our bigger challenges in the midst of everything else that was going on.
Wes?
Yeah, so the challenges around managing IDG manual or homegrown, I think with both of them, and both Ben and Slayton touched on this, to me, it's all about integration. You can have maybe your spreadsheet that you use to bring on people or provision people, but does that spreadsheet then tell you, once you got them provisioned, what roles did you give them? What access to applications did you give them? And then, okay, I got that, maybe I have that in the spreadsheet, but then, okay, well, who authorized the access that you just gave them? Who's that? Well, and that's important because later on, HIPAA says I periodically, no further defined than periodically have to go and reauthorize those people that I just gave authorization to. So when you're trying to do this, particularly when you're trying to do it manually, there's just so many places where the ball could get dropped from a compliance perspective only. There's so many places the ball can get dropped. It's just extraordinary. And then from a security vulnerabilities perspective, that it's that role-based access. Well, why did you give them that role? Yeah, because I just, Wes is an ED doc. I'm not really an ED doc. Wes is an ED doc, and Frank came in, and Frank's an ED doc. So I just gave him the same thing Wes had. Well, Wes was also, the GME director and something else. So now we gave Frank all the other capabilities. So you got all those vulnerabilities that you have to worry about when you try and do this manual. From a homegrown perspective, yeah, if you just got to be able to think of where all those intersecting pieces are when you're growing that homegrown system. And frankly, most of them didn't, because most of the homegrown systems were there for your joiners, movers, leavers. We've got these people coming on, so we need to get them access, and this person moved over here, we need to change that. So that's mostly what the homegrown systems were about. And in both of those, not just those, but all systems, all identity governance systems, I think one of the bigger vulnerabilities that we face, and I see this from a COVID perspective as well. When COVID came, a lot of people got shuffled around. So the ambulatory nurse that was out in the clinic then had to do a shift over on the COVID floor, so that the COVID person, the people that were working that, could take a break. So we had to give that nurse the same access that the inpatient nurse had, and we got through all that, and we gave them, like Slayton said, we gave them the access they needed to see patients. Perfect thing to do. Now everybody's back in the normal status quo, and I bet you like 97% of the people out there didn't take back those old privileges. Now that they're not an ambulatory nurse, they still have the privileges for the ambulatory nurse. And so that's really, we're starting to see a lot of folks really consider IDG now. And I think that's one of the major reasons is they go, okay, we did this for COVID, and now we came back and things are just all screwed up. And I don't want to be in that position again. So I'm going to get a system in place to help me manage this in case something else like this comes down the road.
Ben, these scenarios that Wes was throwing out, how do they sound about pretty accurate to you?
Yeah, I mean, and quite honestly, I mean, I don't know how an organization that didn't have, some sort of tracking methodology in place would even untie that. It's almost impossible, for as fast as everyone was working, as COVID was hitting, and the movement and the changes that were being put into place were happening, that you could effectively, with the staff that you had, track all of that without some sort of solution in place. But yeah, what Wes was saying was spot on.
Slayton, anything you want to add?
As Wes talked about, we were launching Epic on the inpatient and trying to go through a whole new security roles that were going to be changed from Cerner Epic. That was a nightmare in itself. But now all of a sudden trying to do that in the middle of COVID, and like you said, shifting people back and forth. So very same scenarios, just trying to manage through that. But biggest part, as we've been doing, is going back through and doing the validation since we went live and confirming where we are.
And one of the other ones, that one of the other bigger threats to me, something I've worried about and tried to ameliorate as much as possible during my career, is something I call stack shares. In healthcare, I don't know if it's like this everywhere, but in healthcare, you got workers that are 35, 40 years in the organization, and they didn't stay in the same place during that 35 and 40 years. They started out in maybe admission, and then revenue cycle, and then a clinic ward or something like that. And as they went along, they gained access. They gained the shares access for accounts receivable, and then the shares for clinicians, and then the shares for something else, and the shares for something else. So all of a sudden, you've got this user that is not an admin user, no admin credentials at all, but they still have access to like 80% of the shares on your network, just because they've bounced around the organization and they've never been, those shares have never been taken away. It's a stacked shares problem is what I call it.
And then their manager hires somebody new. So then their manager hires somebody new and sends a IT request and saying, "Hey, set this new person up like the old person." Yeah, it's how that just proliferates across multiple people.
Wes, do you think I've heard recently that the cyber criminals out there are really attacking people, very, very focused on
Yeah.
researching specific individuals,
Hmm.
um, and usually by department or seniority. But you just made an interesting point. Do you think they're savvy enough to be targeting people who may not be at the executive level, but who have been there 35, 40 years for the reasons you identify?
Well, thanks for pointing that
I think,
particular threat
unfortunately, yeah,
out to all the bad guys,
yeah.
Anthony, that may be listening on the call.
Sorry. Whoops. No,
Yeah,
seriously.
that had never occurred to me, but yeah, I think that's an incredibly valid point. Hey, let's see, and we announce this all the time. Who's the 35-year award recipients
Right.
at the organization? Well, just target those people, and you're probably an 80, 90% chance that they've got access to 70% of the resources in the hospital anyhow.
Wow, that's a little freaky, huh? That's
It is.
pretty
It's
interesting.
and it's endemic. I haven't run across any place so far that has a great handle on that, frankly.
And you call this stack shares? Stack share?
Yes, stacked shares. Yeah, because
Stacked.
it's a share.
Uh-huh.
It's a folder share.
Okay.
A departmental share where you share. You share folders on the department. So they just keep getting stacked on one on top of the other, one on top of the other, and really with some good identity governance systems like our identity governance system. When you assign a role to like a nurse or something like that, we know what shares and let's say an ICU nurse, we know what shares an ICU nurse should have. They've got their personal share and a departmental share and something like that. So you can go in through the GRC, the governance risk and compliance module, and say, okay, show me all the people who have more shares than what their role says.
Mm-hmm.
And
Mm-hmm.
so that's a way you can start working on that stuff.
And you could see why it wouldn't have been intuitive in the past to take it away. It's almost like, well, they earned that, so why would they take away something they have earned, a privilege is earned? But we know that's just not as smart from a security point of view.
Well, and then healthcare is kind of unique too. I mean, they're staying in the same organization, and 9 times out of 10, they'll apply for this new job in a different department, and then those department managers will talk to each other, and the losing department will say, "Yeah, you can have them at this date, but I still need them to do this project or this project." And so, there's actually a legitimate reason for
Mm-hmm.
them continuing to have that share for a little while,
Mm-hmm.
but there's never a, okay, they've fully transitioned, now take it away from them. There's that just and healthcare, and I think Ben and Slayton, our number one priority is to facilitate the delivery of care. So that has been exactly what we've been doing throughout this, from the inception of our career field. And part of that was, that provisioning and getting them the access to applications and stuff that they needed. Now we've done that. We've opened Pandora's box, or we've squeezed the toothpaste out, and now we're trying to get it back in there. Whereas, and that, oftentimes you're better off just throwing away that old tube of toothpaste and starting with a new one. And that's the way that you can force the role-based access controls, the single shares, that kind of thing.
Slayton, I see you nodding. Anything you want to add there?
No, I like the comparison of the toothpaste, because we all spend a lot of time trying to put toothpaste back in the tube, but
Yep.
it is because of that. As we look across the different places, the nurses float all over the place, staff float all over the place, and trying to manage that in an automated system is extremely difficult, which is why it led to so much of us trying to make all of these different exceptions. And so part of that is going back and not only doing the validation through having some automated tools, which if you don't have the ability to do that, makes it extremely difficult. So as Wes talked about, going back and start here, run this report, understand what folks have, because you have so much change, even in your IAM
Yep.
teams, right? They change, so they don't know what's been run at certain times and things like that. So a lot of it is just stay on top of that, but it's how many folks have gone out and brought in Epic security consultants that sit there and walk through all of the security roles that you know, when you think you should have around 100 to 75 and you take your first snapshot at and you got about 475 roles, you're like, how do I have this many roles? And so that's part of getting your arms around is understand what you have and having a tool that gives you that visibility.
Wes, do you think you're picturing a new logo for Imprivata with the tube of toothpaste? And no.
No, I don't.
Okay.
I don't think the marketing folks would go for that.
All right.
No,
Well, I can work
or
up some sketches if you want. All right. Maybe not. All right,
maybe
Ben.
not.
Ben, let's run this one by you. And Wes, we talked about this in the past about how it can be difficult to get moving with a project like this because all the departments that
Hmm.
have to be involved. But Ben, what are your thoughts on tips for implementing? Yeah, let's say we've convinced some folks on the line today that they want to get off their Excel spreadsheets. What are some tips for implementing a solution? What departments or executives does IT need to work with?
Um, well, HRIS is going to be your best friend and worst enemy. Um, you need to convince them that their solution is the system of record, and that they need to provide you that data in a timely fashion so that you can draw that into your solution to begin to build your baseline your baseline account structures. Um, in healthcare, your payer and provider data management organizations are also going to be incredibly important for you to pull into the conversation at a baseline. Then as you start to work down into your applications, you start to look at what are the most important applications that I need to be drawing data from, pushing data to, and automating account provisioning. So, you look at your EMRs, you look at your external, your cloud delivery model, you look at, all of your major applications, and you start to kind of work your way down from there. I would say, when you are implementing a solution like this, one of the reasons why your HRIS folks are going to be the most important is because they're going to tell you whether or not they're about to implement a brand new HRIS platform that may or may not cause significant delays to your IDG platform, because you have to have a solid model around HRIS and the accounts, or sorry, the employee data builds within that system. That was probably our biggest takeaway, right? We had a major delay of the solution due to COVID. The actually both solutions due to COVID. And then, we were ready to go, and, we had, staffing issues within my IAM platform. And then another delay on the HRIS platform caused all sorts of fun issues. And next thing you know, we're going live about 6 months past when we originally planned on, which caused all sorts of other fun problems, including, weeks to months worth of delays in getting accounts structured, et cetera. So make sure that you are in tight alignment with your HRIS group. Make sure that as you are, understanding how you're building out your IDG platform, where is your source of truth for all the data that you need to be pulling in. And then, as you kind of go down and you start to build that role-based access out, that's when you need to start to look at, okay, who are my, at least the way we're looking at it, who are my highest turnover parts of my organization. For us, nursing is one of our larger turnover areas, for better or for worse. So we're working with all of our nurse leaders across all of our different hospitals to say, okay, when nurse comes in at Danbury Hospital on the 6th floor, what do they need? right? Now, obviously, we've already run reports to say, 90% of nurses that work on this floor get this type of access, 80% get this access, 70% get this access. And then from there, we start to work down to say, okay, what is, of these folks that, 5% have access to this, do they really need that, right? And you start to work through it that way. And if you, take it in chunks, you're never going to, you don't want to try to do this all at once. Phase approach this thing, because if not, number one, trying to do it all in 1 year, you'll walk into your CFO, CEO, CIO, whatever, wherever you report to your next level ops office and say, I need $5 million to do this in 1 year. They're going to laugh you out of the office. Now, if you take that in chunks over 2 to 3, 4 years, working down the chain of risk and complexity, you're going to be much more successful in, number one, getting buy-in from the organization, because you're not going to bury them, and number two, from a cost perspective, it's going to be a little bit more palatable. I will say, you need to understand that this is more complex and probably end up being more costly than you first expect it to be. So, expect that. But I will also say, probably 4 or 5 years ago, I had a conversation with a to me, very well-respected CIO. And, his take on it was that he would never implement a solution like this, because I could hire 20 people for 10 years for the amount it would cost me to implement a solution like this. And with the way we have been able to implement our solution here at Nuvance, I holistically disagree with that viewpoint today. Maybe back then, but I think the solutions at this point have gotten to a place where if you bring in the right integrator, if you select the right partner for your organization, and you get the organization behind you and drive the vision into the organization, you can implement a solution like this and find ROI in probably less than 3 years.
Very good, Slayton.
I was going to say,
Oh, go ahead.
Go ahead, Wes, if you had something.
Yeah, I mean, it was just to hammer home Ben's point. A lot of people think that identity governance is a project. It is not a project. It is a program that is continuous. You're not going to be done with your identity governance project.
Well, all right, Slayton, you want to go ahead?
The same page with you. That's one of the pieces of so Ben, you left off the float pool nurses that you try to figure out. So
I was taking off the easy ones first. They go at the end.
So when we look across, when we talk about departments or executives, remember this is a change management piece. Technology, you can make a lot of technologies work. It really is the operational alignment that you want to make sure you have as you go through this process, because we're not going to feel as much pain as the nurses and docs and techs and folks across the hospital trying to get access to the various pieces that they need to have access to. So that buy-in starts with the senior leadership, making sure they don't think this is just an IT system versus a program that's being shoved down them just to do a compliance thing. It really is to make sure you have the alignment of the operations. So we go all the way back to the caregivers have access to the information they need to take care of patients. And that's what we jump through hoops to make sure that happens. So when we talk about the nursing side, who typically oversee all the nursing and the tech services that go along with, which is, a large majority of your users, and the clinical side, obviously, is making sure you've got that right alignment with them right up front and sharing with them, what this really means. And so as we were going through this process, and Ben, you're right on, it's like how many folks were in the IM team, and what was the benefit analysis at the end, what it was going to look like, and we can go spend $5 million on this tool, but take it in chunks and figure out that my team goes from 20 down to 9 or something like that, right? So it's working through that. And then the last piece I'll highlight is when you talk about the HRIS, it's not only getting access to that, is the information in that HRIS really reliable? We have to have a gold standard somewhere, but how much gets manipulated in various other systems so you finally get it to where it gives you what's relevant, that you can align that to the person's user security settings. And that's what we found the biggest piece is working with HR was the descriptions were so generic that it was difficult to turn around and say that this nurse worked in this area, that it should have this role. It was rolled up at such a high level that it made it very difficult. So it was going back to our HR teams and saying, we really need to be a lot more descriptive in the various additional fields within our HRIS so we could get to a more viable, descriptive security role for our folks. And that's what we're doing right now. And you said it. We were so bored, we were implementing Epic at the same time. We're also implementing our new HRIS system at the same time. So in the midst of COVID. So, but that's our biggest challenge has been figuring out how we get the right information, or do we have the right information in our HRIS to get the roles drilled down at the level we need to.
So did that actually help your IDG delivery, program delivery, you know, that you were going through the Epic build at that time so that you could kind of align that? Because that's always been one of my problems. I've always had,
you know, it forced the discussion. We already got the approval to do the new IAM solution, but it forced the discussion about taking it from a system to a program, because we had to get it right as we went live to make sure people had the right access within Epic.
Got it.
All right, very good. Slayton, we're gonna stick with you. How does having an identity governance system help with compliance issues in terms of always being audit ready?
I think we talked about the spreadsheets. You know, where you have, it's really having that visibility, as I started to touch on before, being able to look at which types of reports you want to generate and then doing the validation. You know, I've lived the life of turning around and sending Excel spreadsheets to various teams throughout an organization and have them do the validations to come back with, well, those people don't even work here anymore, right? So it's really having that visibility. In fact, the nice part is, to a certain extent, it's built all the way up into a dashboard. You don't have to worry about compliance coming to you anymore. You can actually have the visibility. Compliance can have a visibility throughout the time versus a snapshot in time as well.
Mm-hmm.
And so that, I think, helps as we go through this and lift up the covers, see what's across the board, and engaging with compliance so that it is not a one-off type scenario. It really is a partnership with them, knowing we were going to do a forced audits, but also for them to do random audits is the other side of this, for them to go back, because when you have those audits that they want to go do, they now have the tool set to go look at it and really sort of that open the kimono up and say, this is what we've got, this is what we do, and this is what we're working towards.
Ben?
Yeah, I honestly don't have a whole ton to add to that. I mean, the idea of, you know, I think the one caveat to all this is that you need to think about the reports and what you need to what you need to be able to provide to your compliance organization up front, so that as you're building your platform, that you can, you know, make sure you have the data available and, you know, easily build reports out so that in the end it's, you know, press the button and shoot the report out to your compliance organization. You know, having a solution like this and not having to have people runs, you know, into 6 different solutions and pull out data and cross-reference data and do all this sort of stuff to, you know, provide a quarterly report to whoever they need to provide it to, does make life significantly easier.
Wes, anything you want to add there?
Yeah, I like the way Ben phrased that. You know, we're all three had spent some time in the Pacific Northwest. That's a big lean country up there. And what came to mind, and I've actually done a presentation on this, Ben, when you were talking, was, you know, begin with the end in mind. And
Yep.
that is what do I need to show proof of compliance? And what do I need to get done what I need to get done? And then you work your way back and make sure that you've got all that data. And frankly, in identity right now, there's really 3 main areas. Slayton mentioned one, the periodic access reviews. That's HIPAA that's going to be looking at that to make sure that you conducted those periodic access reviews. Your EPCS now. DEA hasn't started enforcing that yet, but they will. And so you need to be able to report out on EPCS. And then something I've been caught on, raise my hand. I've had to explain to the board why Joe Bag of Donuts, who left 6 months ago, still has access to the Lawson system. Those are really the three places where an audit will really catch you out. And I'm liking the tendency that IAM is moving under security more and more often, because as you guys have heard me say before, identity is the new control plane, and that's where you can control the risk. And so that's another begin with the end in mind. I want to control the risk, and so this is what I need in my identity governance system.
Yep. And if you set up that identity governance system well, Joey Baggy Donuts is going to lose his access when he leaves the organization, because it gets plugged into HRIS, because no one wants to pay Joey once he's not working in the organization anymore. So now you're auto killing that account.
Yeah, and that's going back to the original question that we started the conversation with. Where's the vulnerabilities in a homegrown or manual system? There's a great big one right there. Is that you're relying on people to know that people left the organization in a manual system, and yeah, sure, 98 times out of 100 they're correct, but there's 2 times that they're not. Whereas when you automate it, it's going to be 100% of the time.
All right, I think this is an important question, Ben. I wanna run it by you. How can CIOs, CTOs, CISOs convince the rest of the C-suite and/or the board to invest in an automated solution? You mentioned the idea of don't come in and ask for 5 million, right? You got to think it out, plan it out better than that. So what is, if you believe in this, you're looking at the risk to the organization, you believe this is a necessary expense. What's the best way to communicate that to the people who were going to have to sign the check, so to speak?
Thank you for another easy question to answer. Very, very nice to meet you today. I hate to answer it this way, but there's a very large it depends that's part of this answer, because every organization is going to be a little bit different based on their risk acceptance model, the amount of money that they have, whether it be op or cap, and whether or not your senior leadership is interested in hearing about IT holistically. I think there's a couple of different ways you can go about it. You can obviously go about it from a risk reduction direction, talking about the automation and the reduction in audit findings, the reduction in actual access, inappropriate access, the reduction in inappropriate privilege escalation, a lot of that sort of stuff, right? You could talk about it from a cost model perspective, and I would say, I threw that $5 million number out there. For an organization our size, it's not $5 million, right? But if you think it's going to be a 3 to 5 year project, lay that out for your organization. Talk about, year over year, these are the costs that it's going to take us to get to this, this better place, however you want to define what that benefit is going to be for your organization. And then talk about, the how you are going to move through and how you're going to engage with your organization, how you're going to manage change management, and give your executive team the understanding that you've thought this through and how it's going to benefit your organization. There are places here where there is some level of ROI. Like every security project, oftentimes some of that ROI ends up being, that ethereal risk reduction stuff. And your CFO will look at you like you've got 6 heads if you really try to tie that to, direct monetary savings. But, you have the opportunity to say, you know what, right now I have 15 people or whatever it is working to set up accounts. Well, if I can automate 2/3 of this, I can reduce my headcount here by 3. Or reduction in headcount probably is not the best way to look at it. I can use those folks to do other things more effectively for the organization, right? That's probably the better way of looking at it.
Yep.
So you can start to look at that across the board. There might be other technologies that you might be able to get rid of. If you go kind of an enterprise solution route with a company that may or may not be here and supporting this this discussion today, you can start to look at reduction in cost just because of scope and scale of your contract with a vendor like that going in an enterprise route. So there's a bunch of different ways you can take it, but you as a leader have to really understand how your organization looks at these sorts of decisions. And sometimes it's I hate to say it, using either an event that's happening to you, happening to a peer of yours, or happening nationally to point to say, hey, we've got a crisis over here. This could happen to us. This is why we need to do these sorts of things.
Very good. Slayton?
I was going to say, convincing the C-suite right now with everything that's been going on is it's got their attention. I mean, I can't imagine any one of us not having these conversations weekly or even daily nowadays in regards to what's been compromised, and going back to it's the users, right? Where a lot of these attacks are compromised based on something that a user did or didn't do. The other side of that is when you're renewing your cybersecurity insurance, you may have some ROI that you can, say, if I don't have this, then my cybersecurity insurance costs. So you now have something to tie that back to if you're not self-insured, depending on how you manage that. But I would say right now the attention towards the security portfolio, not just any one thing, but the portfolio itself in healthcare with the target that we have on us, couldn't be higher. And as we go through these things, it's really prioritizing this based on some of the other risks and bringing that back up to your security program and identifying it. But I think we've got their attention, and at the board level as well, asking us of what do we need to spend. Maybe this is an out of cycle spend, CapEx or OpEx, because of the things that are going on. And so we're starting to see that as well. Not even here, we're just talking to some other friends of mine of, hey, if we need to do this, there's a lot going on right now that has the board and executive level attentions. And if we've got gaps, they're willing to listen now.
Wes?
Yeah, I'll quote Jake Gaisley, a CISO analyst that was at the NIST conference that they held a couple months ago regarding the SolarWinds attack. And he said something, I'm probably paraphrasing, he said something like, in regards to the SolarWinds attack, come to find out identity is everything. And that's, I mean, you can't get any more explicit than that. And like Slayton was saying, the board is paying attention to SolarWinds was a huge one that they all paid attention to. And you can take that quote and walk into your board. Look, SolarWinds, remember that? Well, what was it about? How did that get so bad? It's identity. So we have to manage our identities way better than what we are. I mean, it's kind of, when you think about it, it's kind of ridiculous that IT and health IT to a largest degree find ourselves in the position we're at. We would never design a system to work like this. We would never give access to a whole bunch of people and then go, hell, we got to figure out what we gave access to and why we gave them access. No, we would design this from the jump. We would decide, hey, a nurse gets this access, a doctor gets this access, and before anybody got any access, we would have that process in place. But that's, again, going back to our number one dealio is to make sure that clinician can see can service their customer, the patient, and so we didn't do the first thing first, and instead did the second thing first.
And now we got to go back.
Yep, and now we got to go back.
Yeah. All right. Ask a co-panelist, my favorite section. Wes, why don't you go first? Do you have a question for one or both of your co-panelists?
Yeah, I've been thinking about this, just briefly, and Ben was over in the Pacific Northwest, so he was a West Coastie. a Tupac guy there for a little bit, and now he's on the East Coast, and he's a Biggie man. So
Oh my God. Oh my
what?
God.
Oh, you went there. Okay.
Yeah, I didn't
All
see
right.
that coming. I did not see that coming.
So is there a difference that you see, Ben, between the attitude, the consciousness the of the board and the C-suite from a security perspective, East Coast versus West Coast?
I mean, I think just due to the increased news coverage and increased attacks and directed attacks against healthcare, I think I see a bit more here.
Yeah.
I was lucky on the West Coast to have someone on my board that was, she owned a information security services company. So, I had someone there that got it, and I could work with, and she could, do translation if we needed to do that sort of thing for the board. Here's a little different in that, my board of directors is filled with, Fortune 100 execs. So, it just being in the region that I'm in, we have a lot of that sort of representation on our board.
Mm-hmm.
And, they're a little bit more savvy around information security and technology. We actually have a technology subcommittee of the board. So, I have direct reporting responsibility there. I have direct reporting responsibility to the audit committee as well. But they're very tuned in. They very much get where we're going, but they also understand risk. And I think, that's, to me, is just as important as having a board that is tuned in to security holistically, is, understanding that we are not going to get to zero. There's no way that we are going to be able to protect against everything. It's about how do we react and how do we respond to reduce the risk of it getting getting really bad, turning into something, really, really bad. Wow, my brain just turned off, so I apologize.
Yeah. Yeah. Well, it sounds like you're more on the Biggie side, man.
Good, something like that. Thank you.
All right, listen, we only have a few minutes left. I want to give everyone a chance for a final thought, last word, piece of advice for your colleagues who are listening and are going to hear this. What's your final piece of advice? Ben, why don't you go first?
Don't be afraid. This is something that can be done. Do it in bite-sized chunks. Start, even before you get into identity governance and start to talk about, working with an Imprivata or another solution that's out there. Look at, take a look at your executive suite. Take a look at your admins, and make sure that you're not mixing access controls for those folks, right? Take those that lower level those lower level tasks, and make sure that you have the right people doing the right things and having the right access. And then from there, start to continue to mature your program one step at a time. And I think the other thing to really look at is, it is a program, as Wes said earlier, but to have a program, you need a program manager. You need people dedicated to this. You need to put time and resources to it, as well as the funds to get the solution in place.
Slayton?
I'm going to steal a little bit of what Wes said, but also kind of, top of that is start with the end in mind, right? Wes and I came up to very similar background. If you look at I got hammered on LinkedIn, so I'm thinking a few people went out and looked at our LinkedIn profile. But the understanding where you want to get to, and as Ben talked about, take it in chunks. That start with the end in mind really makes you start thinking about where you really want to be and what can you tackle as you go through this, because it is going to be a journey. If you're just starting down this path, it is not going to be something that you can do in 3 or 6 months, but you can do portions of that. And then the second piece is make sure, and I said this before, but highlighting again, make sure you have that operational alignment. There are so many times, I've seen in the past that where the IT department's running down the flag with the big IT flag and, put it in the middle of the command, the executive suite floor and say, we're going to go forth and do this, and you just set yourself up for failure. You've got to make sure you got those operational alignments and the buy-in from the C-suites and where they are, because that's where they're going to go when something doesn't go right, and there's going to be parts of it that you thought you had covered and something's going to happen, and making sure they truly understand what that is, because the nurses and docs and techs are all going to run back up to the C-suite, and then they're going to call up the CIO and say, hey, what's going on here? So make sure you get the right operational alignment. Make sure you start with the end in mind.
Very good, Wes.
Yeah, I mean, Ben and Slayton, probably took the top 4 things, I would say, but maybe number 5 would be just get started. It's the problem's not going to go away. You've lifted up that rock, and there's some dirty critters and ugly critters under that rock. They're not going to go away. You need to do something about it. So just get started. I guess, we were talking earlier before, 1980s, in the 1980s, the Reagan era, it was just say no. And now it's just get started.
Wow. I can't think of a better ending than that. Drop the mic. That was a drop the mic moment, Wes. Very good. That's about all we had time for today. Regarding continuing education, you can use the final slide in this deck. You'll get an email when the on-demand version of this event is ready for viewing. If you want to sponsor an event with us, you can reach out to Nancy Wilcox from our team, and you can go to our website to register for upcoming webinars. With that, I want to thank our tremendous panel, Slayton, Austria, Ben Smith, our friend Wes Wright. I want to thank Imprivata for working with us again and making this event possible. And I want to thank you, our attendees. And with that, everybody have a wonderful day. Thank you.
Thanks, everybody.
Thanks, Anthony.